Welcome to It's Your Case, presented by VetCT.com. I'm Amy Zalcman, your radiologist on demand for this week. We continue this month's theme of fluid. Today's case is a 15-year-old female neutered Shih Tzu who was found laterally recumbent by the pet sitter. She has been generally weak. She vomited several times and during her initial assessment was found to be hypoglycemic. There is mildly reduced serosal contrast in the cranioventral abdomen, where we observe thin strands of soft tissue settled along the falciform fat. We observe slightly similar changes, but less conspicuous, in the retroperitoneal space. The margins of the liver and the spleen are within normal limits, and there is a small amount of heterogeneous material within the gastric silhouette. The lumbar vertebral column is relatively unremarkable, but we do see evidence of remodeling along the femoral head bilaterally and the lesser trochanter of the right femur. Our principal conclusion in this patient is the loss of serosal contrast in both the peritoneum and the retroperitoneum. This is consistent with a mild volume of effusion. The presence of low volume peritoneal effusion can be significant in light of this patient's historical collapse, and this should be correlated with both the history as well as her physical findings, such as presence or absence of abdominal pain and pallor. It would be ideal to collect a sample of this fluid that can be assessed for the presence of inflammation, hemorrhage, or intracellular bacteria that could indicate a septic process. Abdominal sonogram can be useful to provide further insight into what's happening with the parenchyma of the liver, the spleen, as well as the pancreas. It should be noted that in critical patients that are dehydrated, as you improve the hydration status, the volume of effusion can increase proportionally. A large volume of abdominal effusion markedly reduces the serosal contrast in the abdomen by being superimposed and interspersed with peritoneal fat. Be sure to view the full report associated with this case. Thanks for listening, and remember, it's your case, so please post your questions on social media.